Kolkata, formerly known as Calcutta, is roughly the same size as Dublin. However, the populations of both cities could not be more different. Dublin is home to 1.5 million people, while the population of Kolkata is estimated to be as high as 17 million people. This means that for every one person living in Dublin, there are 12 people in Kolkata, even though both cities are the same size and cover the same geographical area. This extortionate population leads Kolkata to be densely overcrowded, polluted, dirty, busy and noisy. According to the World Bank, almost 50% of the population of India lives below the poverty line, which means that almost half the population of India, which amounts to over 500 million people, are forced to survive on 91 cents a day. This means a person has to try and support themselves with food, clothes, shelter, medical care and all the other necessities of life on less than €1 per day, a task that is quite literally impossible. It is clearly evident from the sights we see around Kolkata that millions of its inhabitants are living in profound poverty. Ireland has a social welfare system in operation, which means that if somebody finds themselves unemployed or sick, or a family finds it too difficult to cope financially, the government is at hand to ensure that every person has a roof over their head and money for food and medicine for illnesses. Education is free in Ireland, and the fact that education is compulsory is strictly implemented. But this is not the case in India. There is a social welfare system in place, but this is very difficult to access for an array of complex reasons. Migration is a factor, as people may, for example, move from Bihar to West Bengal, and so responsibility for these people lies with Bihar state, yet they are now living in West Bengal. Massive population figures means that resources are heavily stretched, and due to the fact that to acquire these services you must hold a permanent address, this creates massive problems for the street populations who are all homeless and so cannot apply for government support. And so the unemployed, sick and those in financial crisis have nowhere to turn for help or support. The underprivileged cannot seek social welfare housing, job seekers benefits or unemployment benefits like we can in Ireland. Instead, they take to the streets, sleep on the pavements and are forced to beg for survival. Education becomes a luxury few can afford, as children must work to supplement the family income. Healthcare is just too expensive, and so many die of curable illnesses. So many of the things we take for granted in Ireland, a warm home, free education, decent clothing, more food than we can stomach, medical care whenever required, computer games, iPods, annual holidays, everything we take for granted are the things that the underprivileged in Kolkata cannot even dare to dream about. A familiar sight in Kolkata is the sight of young children and adolescents, semi-naked, malnourished and dirty, making their way through lines of traffic begging for money for food. These children are street children. They either spend the entire day on the street begging or working and return to their families at night, or they spend day and night on the streets unaccompanied by adults, alone, fending for themselves with no families to return to. According to the Ministry of Women and Child Development, India has the world's largest number of sexually abused children. A child below 16 years is raped every 155th minute. A child below 10 years is raped every 13th hour. In India, 1 in every 10 children is sexually abused. 42% of Indian children are malnourished. Half of Indian children are underweight. India has the highest number of illiterates in the world. 34% of India's population are illiterate. Only 48% of girls of school-going age are enrolled in primary school. 77% of men in India are literate, while only 54% of women are literate. It is undoubtedly one of the most shocking sights in India to see the sheer volume of children roaming semi-naked, dirty and unkempt throughout the streets, rummaging in garbage and begging for money to buy food. Children so young, completely alone, with no protection, security or source of care. Nowhere is this sight more prevalent than on the streets of Kolkata, an existence that nobody here can even begin to imagine or understand. The Hope Foundation was set up in response to these issues faced by the underprivileged in Kolkata. The organisation began its work in 1999 in an effort to support and restore the basic human rights of the underprivileged in society in and around Kolkata. Our goal is to provide support and skills that will enable children and their families to build a better future for themselves. Hope has many different programmes and projects in operation simultaneously. The Hope Foundation's head office is in Cork, with 2 further branch offices in the UK and Germany. These 3 offices are responsible for ensuring funding is in place to allow the projects on the ground in Kolkata to operate. The Hope Foundation branch office is located in Lake Gardens in Kolkata. This office receives funding directly from Ireland and distributes it to the implementing organisations. The implementing organisation of the Hope Foundation is the Hope Kolkata Foundation, which is responsible for carrying out the programmes and projects for the underprivileged on behalf of the Hope Foundation. Apart from Hope Kolkata Foundation, the Hope Foundation also gives funding to 14 other local NGOs. These local NGOs run many projects for the underprivileged in Kolkata that fall into the criteria of the work done by Hope. These local partners also get funding from other sources for their other projects. Thanks to the generosity of donors, fundraisers, volunteers and sponsors, and in particular schools in Ireland, Hope is able to continue to fund their projects that support the most needy in Kolkata. Hope operates 4 main programmes: child protection, education, healthcare and skills training and income generation. Advocacy and liaising with the government and other NGOs and stakeholders is very important to Hope's work in raising awareness of issues faced by the underprivileged in Kolkata and strengthening the ability of the oppressed to achieve their rights. This advocacy work is very much a part of the 4 programmes operated by Hope. Together, the Hope Foundation and its local partners in Kolkata operate 9 protection homes. These protection homes cater for 301 children and are located in different parts of Kolkata and the district of Howrah, which lies across the River Hooghly. The children living in these protection homes come from economically deprived backgrounds and have suffered gross human rights violations. Many have been physically and sexually abused. Some have families who just cannot afford to care for them. Some are abandoned or orphaned, and all have had to face profound poverty and suffering in their young lives. 6 of our homes are specifically for girls, due to the fact that girls are at an increased risk of being sold into the sex trade or married off at a very young age. The children in the homes now have the security of a caring and loving environment. Each child attends school every day, either locally or in a boarding school. Every child takes part in extracurricular activities including dance, singing, music, art and crafts. Weekly outings to the park take place, and an annual holiday by the sea is something that each child looks forward to. The children are cared for in every way and avail of counselling both individually and in group sessions to ensure that they work through the issues they have faced in their young lives so that they can move on into the future in a healthy manner. The children in our homes are happy and healthy and have been given the chance at life they deserve, ensuring they never have to return to the reality of their past, sleeping on a pavement, begging for food to survive. Child Watch is also a project under the Child Protection Programme. Child Watch was introduced to raise awareness of street children's issues and as a preventative measure. It aims to eliminate child labour, protect children from abuse, rehabilitate children who are addicted to substances and generate awareness of the child's right to education and healthcare. Liaising with the government, Police and Child Welfare Committee to highlight the issues and abuses faced by the underprivileged children is a big part of this project. A night round is also incorporated into the Child Watch project, whereby an ambulance patrols the city at night, rescuing children in difficulty and taking them to a safe environment. Education is the key to breaking the vicious cycle of poverty. The Holistic Education Programme aims to improve the educational level of slum-dwelling children and street children. Hope, with its partners, operate 9 creches and 32 coaching centres throughout the city. 2,807 children attend these educational centres. The creches provide pre-primary education to children under 6 whose mothers are working. The creches allow young children to be ready to be mainstreamed into formal schools and also gives the children a safe environment in which to stay while their mothers are working. The coaching centres operate all day, as school times differ from place to place and are for children who are already in school. They give them a place to study and to have access to extra tuition and support from qualified teachers so as to enhance and improve their educational abilities and ensure that they can achieve the best marks they are capable of. This extra support is very important as the majority of these children are first-generation learners, which means their parents did not go to school and so are unable to help them with their homework and have little understanding of the importance of grades and the need for study. The creches and coaching centres provide the children with food, health checkups, mainstreaming into formal schools, educational support, educational materials, school uniforms, capacity building of teachers, networking with government and other NGOs, parents' meetings to ensure parents support their children in school, and advocacy programmes to raise the issue of a child's right to education. Hope also runs a project called Strengthening of Institutional Care, whereby 3 government homes are supported, reaching out to 112 children, offering counselling support and informal education and learning support. Hope does not wish to operate by offering parallel services to the government, but strives to work in support of government services already in place. 4 Nabadishas or drop-in centres are in operation in collaboration with the police, which allows underprivileged children to drop in throughout the day where they receive food and informal education. The Nabadishas are a place of refuge for the children and also lead to children being mainstreamed into formal education. A cricket coaching centre operates every weekend for the underprivileged boys and girls from the slum areas. Children get the opportunity to take part in a team sport and compete with other children, which gives them something to focus on, offers equal opportunity to all children and allows for good character building and team building skills. Hope works to improve access to healthcare facilities, improve water and sanitation facilities and improve health awareness among the slum and street communities. The primary healthcare programme is co-funded by Irish Aid. The healthcare programme aims to reduce infant and child mortality rates and prevent diseases including HIV and malaria. Hope deals with all levels of healthcare problems, from educating communities about waterborne diseases to the education of the underprivileged in society about how to access government services and schemes. Hope supports 35 mobile and fixed clinics that cater to the healthcare needs of the slum and street communities. We reach 22 wards catering to the needs of 34 street and slum communities in Kolkata and Howrah. These weekly clinics provide curative and emergency health support and campaign to increase awareness about different illnesses. The number of cases that have been treated between April 2007 and March 2010 at these clinics was 196,713. Hope also funds a rehabilitation hospital for orthopaedically challenged children called RCFC, providing corrective surgery and physiotherapy to children under 14 who otherwise could not afford this treatment. Hope also runs a rehabilitation centre for children rescued primarily from Howrah railway station. These children live on the railway platforms alone and have become addicted to substances including glue. After detoxification, they are moved to Punarjeeban Home, where they are rehabilitated and supported while they work through the traumas of their past and overcome their addiction. Hope also runs a 30-bed hospital for the underprivileged in society who cannot gain access to the 10 government hospitals. It is co-funded by Weight Watchers Ireland. 22 beds are reserved for children and 8 for adults. Patients are admitted into the inpatient department where specialised doctors and nurses are at hand round the clock to cater to their every need. An outpatient department is also in operation where the underprivileged can come and access medical care, including diagnosis with state-of-the-art equipment including ECGs, ultrasounds and X-rays, blood tests and immunisations. An operating theatre is also in use where all types of surgery are carried out. Hope also supports an emergency response unit, or ERU. This unit is in operation 24 hours a day, 365 days a year. It networks between the local police stations, hospitals and rehabilitation centres. It has the facilities to treat people on the street, including the mentally ill. Psychological support, hospitalisation and treatment are all available. Hope also supports the Mother and Child unit in Arunima Hospice. The Arunima Hospice offers comprehensive care and support to HIV-infected and affected children in West Bengal. The hospice offers treatment for all opportunistic infections of AIDS, actively plans the management schedule for all patients, and takes part in the execution of this schedule. Another project supported by Hope is a community-based programme for the homeless mentally ill called Iswar Sankalpa. This project reaches out to those who are extremely vulnerable in Kolkata due to the deep stigma attached to mental illness and the poor treatment the mentally ill endure as a result of their conditions. Another project incorporated into the healthcare programme is Apna Disha TV, which helps 12 local community volunteers make different magazines about the problems they encounter in their daily lives. The volunteers are taught how to perform videography, photography and computer skills. They produce films about problems faced by slum communities, films raising awareness about improving the standard of living in the slums, and success stories to inspire the slum-dwelling children. Hope is committed to giving assistance to people so that they can acquire the skills and training they need to work independently and earn a living to support themselves and their families. Gender equality is a big part of this aspect of Hope's work. Women make up a large proportion of the poverty-struck population and are often marginalised when it comes to education and employment. Women need to be empowered to access greater control over finances and capital. Hope and its local partners have been at the forefront of many initiatives to empower women from underprivileged sections of society by offering them skills and vocational training so as to allow them to move to a position of centrality in the household, to be more involved in household decision-making, and to be in a position to become more independent by earning an income of their own. This has been achieved by the establishment of self-help groups and a microfinance programme. Hope has formed 24 self-help groups where women are encouraged to save a certain amount of money each week, and from this they can access credit or loans so as to become independent and not rely on loans from outside sources where interest rates are very high and only leads them to fall deeper into debt and the cycle of poverty. Skills training is also offered to both men and women in the areas of computer skills, spoken English, tailoring, art, embroidery, crafts, cooking and baking. Through this skills training, these